Thank you. Well, I think everyone in this place would agree that Australians should have the right to privacy. Our health records are the most highly personal information that we entrust to medical professionals acting in our best interests. I cannot think of a more important privacy relationship than that between a patient and their health professional. And that is why it is so important that we get this My Health Record model right. And what is clear from the Senate inquiry that has gone into this legislation is that currently we don't have it right. So much so that you have thousands, if not now millions, of Australians, as we speak, on the phones, on the internet, opting out of this My Health Record scheme proposed by the government. This government has lost the public trust debate. And so that is why Labor has made it very clear that we want to put in place amendments to this legislation to put back the public trust that is so needed in this My Health Record debacle. Now, the debacle, of course, isn't the only area when we look at the government's records in the area of information technology that there has been. This government has a woeful track record on IT security and privacy. They botched the rollout of the NBN, they botched the rollout of the NDIS, they gave us a census fail, and they gave us the robo-debt debacle. And now they've stuffed up the My Health Record. If you look at the record of this government and its previous versions on sensitive data security, I think the Centrelink robo-debt debacle stands out with lots of kind of bells and whistles on. But then again, what about the Immigration Department database breach that put the lives of asylum seekers at risk by revealing their details? These are just a couple of examples of how this government simply has failed when it comes to information technology security and privacy, and that is why Labor is calling on this government to indeed extend the deadline for the My Health Record to come live, which is due to do so from tomorrow. In fact, my Senate colleague, Senator Watt, successfully passed a motion in this place this week asking for exactly that. And I think this Senate and indeed the government should respect the passing of that motion and indeed the amendment that Labor will put forward to ensure that that happens. To ensure that that happens for the sake of all of the Australians who today are worried and indeed have a right to be worried because this government cannot be trusted in how it is dealing with these sensitive privacy and security issues. Now, I'm also deeply concerned about some of the failings in this bill without amendment. I'm deeply concerned by the potential use by third parties of patient information. I think there is definitely a need for further protections for privacy and security, both in legislation and in policy, and it needs a government, of course, to do that will take all Australians with them about, discussing and educating them about the benefits of the My Health Record, which there are clearly benefits, but also the risks, so that everyone can make an informed choice about whether to participate or not. Now, that takes time, and that is something that this government hasn't done. It has failed to do, which is why we're asking for that extension of the deadline. But what happens if you find that your data has fallen into the wrong hands? Well, Catherine Kemp, Bruce Arnold and David Vaile from the University of New South Wales Law School and the University of Canberra Law School noted in a piece in The Conversation recently, and I quote, they said, "We have witnessed a stream of health data breaches in Australia and overseas, and the incentives for these breaches are only increasing. Storing records digitally with online access greatly increases their accessibility for criminals, hackers and snoopers. Health records are valuable as a means of identity theft due to the wealth of personal information they contain. They are a huge prize for hackers, fetching a high price on the dark web. Well, that is really concerning, and I think everyone would share that concern. But when discussing a medical condition with their doctor, Australians should not be concerned that it will indeed end up in the wrong hands. There really should be the most searching review into the operations and behaviour of the Digital Health Agency, the ministers who signed off on this, and the costs of the public disinformation campaign so far that has misled the parliament, I think, but more importantly, misled the public. It needs to be reversed. We need to have information. We need to have education about the benefits and the risks. And that case simply has not been made by this government. In fact, we need to remember very clearly some of the rhetoric that's come out of Minister Greg Hunt on this issue. Firstly, I know that the government has now put itself in a position to bringing forward amendments of its own bill. But I think we all need to remember that these changes the minister is making, he was forced to make. He was forced to make. He was not going to make any changes to My Health Record. These are not changes that he willingly has made. If you remember, when Labor initiated the Senate inquiry, this health minister said it was a stunt. He said it was a stunt. I mean, for a minister of this crown, of this government, to claim that the important process of legislative investigation through Senate inquiry into something so pivotal, so important when you're talking about privacy and security, by having a Senate inquiry was a stunt, but then to go further and acknowledge through the findings of that Senate inquiry that his legislation was flawed and that it did need amendment, and that he has now brought forth those amendments, shows very clearly the failings not only of this minister, but that he has provided disinformation to the Australian people with what he set out to do in the first place. So, of course, they've now amended their own legislation. But I think that, what has happened is that we needed a much more informed consent model, and we didn't have that. We didn't have that from this government. And I think doctors themselves, it's not just those of us that were on the Senate inquiry, it is not just even consumers that are raising some of these concerns. They are coming from health professionals themselves. They're coming from doctors themselves who've made it very clear, saying, yes, they want to be able to have this partnership with patients. They think that the idea of the My Health Records are important, but they also want to make sure that that relationship is not in any way jeopardised by this notion that the information is just automatically shared, and that they can't actually have, that patients can't have full control of it. And they've raised those concerns throughout this process, throughout particularly this important Senate inquiry process. And I've had in Tasmania, my home state, doctors themselves approach me with their own concerns. They've made me very aware of, firstly, their worry about this kind of simple tick-a-box approach, where errors on requests for pathology imaging tests can occur, about poorly edited shared health summaries, or errors with pharmacy dispensing notifications that may cause unintended or incorrect uploads of data, particularly with the My Health Record. Tasmanian doctors have made me aware of their concerns by what these records will mean for young people. They can foresee an inordinate amount of extra time and effort to ensure that their young patients completely understand the structure, the methodology, the supposed benefits, but also those likely risks of My Health Record, and the real need for them to be alert for exposure of their sensitive information if they do not have control of their personal My Health Record. So the possible and increasing threats to their personal information coming from cyberspace, I think, is real. But the negative publicity around My Health record also does the likelihood, it gives that likelihood that teenagers may, this is an unintended consequence, but may refuse to consult with their doctor or maybe some other health professional, psychologists or the like, through the Medicare system. And that would be terrible. To have a loss of faith would be catastrophic for Australian healthcare, with, you know, serious consequences over not just the short and medium term, but the long term for those patients. So the doctors I've spoken to do fear it would all but destroy that long-accepted recognition by young people that doctors will safeguard the confidentiality of their records. So Labor's privacy and security concerns about this were clearly expressed through the Senate inquiry process and through the committee report process, where we laid bare the government's botched implementation of this opt-out model. We made additional comments in that report which urged the government to commission an independent review of My Health record system by the Privacy Commissioner and the Office of the Australian Information Commissioner, which has itself called for further consideration of several privacy and security concerns. In particular, the Privacy Commissioner and the OAIC, we highlight, should consider the appropriate balance between the utility for clinicians, patients and others, such as carers, and privacy and security for individuals. Should look at the difficulty of ensuring informed consent in an opt-out model and measures to encourage consumer engagement and informed choice. Changes to default access settings that are necessary because of this shift to an opt-out model from our original opt-in model where informed consent was assured. I mean, that is part of the big problem here. The fact that the government has changed this from an opt-in model, which was what Labor's proposal and legislation was originally, to an opt-out model, means the issue of informed consent is limited and jeopardised. We further ask for particular protections for vulnerable people, including minors 14 to 17 and families fleeing domestic violence, further legislative policy and system changes that are needed to achieve these aims. But in the meantime, I think that the government does need to heed Labor's call, support Labor's amendment, and I urge the crossbench to do likewise to suspend the opt-out rollout until the Privacy Commissioner and the OAIC report is taken into account and the government makes those necessary changes, and public confidence then in this important reform is restored. And that is all going to take time. It's simply not going to happen overnight. It's simply not going to happen by tomorrow, with that date looming of the government's proposal. And I think the government needs to explain. It needs to explain to the people of Australia what they're doing to minimise these risks. Otherwise, the whole enterprise will be hobbled in distrust and scepticism and will never move away from that. I think this reform needs public support to work, and that, unfortunately, is where the government has failed. We certainly support, though, the amendments that the government is moving, particularly in relation to issues around domestic violence and around employers and workers' compensation issues. But these are all amendments, as I said earlier, that we signalled months and months ago. Of course we're pleased that the government is basically picking up Labor's amendments now, or Labor's recommendations now. But that being said, we still think there are issues around the default settings of My Health record that do require the Australian Privacy Commissioner to have a look at this whole thing again, and we think that 12 months is reasonable. 12 months is reasonable time for our Privacy Commissioner to look at this, to see whether those default settings are right. And at the same time as that is going on, throughout that 12-month period, government can be running an education campaign to people, not just telling them about the benefits of My Health Record, but actually telling them about what they need to do to actively manage this very important piece of health information, their My Health Record. There needs to be that consumer confidence put in the system, and it's simply not there at the moment. I think what's also been clear is the role here and concern about the Digital Health Agency. In particular, what exactly are doctors being paid to sign up their patients to do and for? And what information about access and usage has or has not been fully or at all disclosed to them? That, again, is an unclear, an unknown. I think, though, implemented by a competent government, e-health could deliver tangible healthcare improvements and save healthcare costs through perhaps fewer diagnoses, treatment and prescription errors. I think that actually could work. It could actually work. But what we don't want to see is people's patient health records falling into the wrong hands. Certainly don't want to see it privatised. There should be no privatisation of patient records, and we don't want to see it falling into the wrong third party at any cost at all. So that's why when we began delivering on electronic health record systems when we were last in office, our system was an opt-in system. We thought that that was the right approach. So anyone who participated had to give informed consent. They had to give their full informed consent. But this government has failed on that completely. Worse, it seems to have actively refused to communicate with Australians about these risks to My Health Record and what this opt-out system means in practice. What worries me today is how many Australians are unaware and do not realise that tomorrow is the deadline for their opting out of this model if they chose to do so. The fact that they haven't been given that education communicated by government, that what this opt-out system means to them, what the risks and the benefits of their My Health Record are, is very concerning to me today. I think, the failure, absolute failure by Minister Greg Hunt, failure of this government to communicate has fuelled so much of the privacy and security concerns that Australians quite rightly have about My Health Record. It didn't have to have come to this, but it has because of the failure of this government. So when our Senate Community Affairs Committee was scrutinising the My Health Record system in September, representatives of the Australian Digital Health Agency conceded that more than 900,000 Australians at that point had already opted out of My Health Record. It is well over 1 million today, and goodness knows how many more by tomorrow. So, with 1 day less from the deadline, my message, I guess, to Australians is to please make yourself informed today about the options, about the benefits but also the risks, about what you choose to do today, whether or not you wish to opt out or not. But more importantly, my pitch into this chamber this morning is to say to the government and to the crossbench, please support Labor's amendments. Support these amendments to ensure that we put back in place the trust that Australians need into this My Health Record model. We need more time to get this right. It is nowhere near right as it currently stands, despite the government's amendments that they were dragged here to put forward. We need more time. We need the review. We need to ensure that Australians trust what we are doing when we say we want to ensure we have a great health system that with a digital capacity to improve efficiencies, and we are simply not there yet. Please support Labor's amendments into this bill.